respond to COVID-19 when you first heard of coronavirus and COVID-19? What was it like for you guys in the physical therapy community?
Monique, you want to start?
Well, to be quite honest, we realized that it was for real. It wasn't fake. I was not sure how patients would actually present themselves in the home. But based on the clinical findings from in acute care, I know they would be really fatigued and weak. I just didn't realize it was gonna be that bad when I actually got into the home. And compounded with the fatigue, the weakness, the inability to sit up for long periods of time or to walk, people are mentally drained and depressed. So it's a lot to handle, and it's draining on caregivers, family members in the home, the patient themselves. And, sometimes you feel a little defeated, but you celebrate every little step that, a person takes. Like one patient today walked 10 feet, and that was great for us. And, we appreciate that.
And was that a patient who was previously healthy before COVID-19?
Yes, completely healthy. The only issue that he had was hypertension and diabetes, but it was well managed. In his situation, unfortunately, his wife tested positive, but she was asymptomatic and passed it on to him, and he has been battling it since.
And that brings me to my question, which is, are you afraid when you go to take care of these patients? How do you protect yourself from transmission when you have to head into the homes or see them at the outpatient facility? What are you guys doing to protect yourself? Because a lot of what you do does involve hands-on work, meaning you're within 6 feet of the patient.
Yeah. You are very close because you have to help them get out of bed. You have to help them sit up, give them support, turn them prone. Actually, sometimes you have to perform chest PT depending on if they're still having a lot of mucus on their chest. So you're pretty close. It was scary at first. I held off as long as I could possibly, not treating, because I didn't want to have people that I was around be at risk for getting infected.
Right.
And also my family members. They're not here, but in discussion they were like, I don't think do it. But eventually I gave in because I realized people needed help, and the cases kept coming in, and other people were refusing them. So I finally gave in and said I would start treating. We have to wear full personal protective equipment. So before I enter the home, I have to put on headwear, face shield, N95 mask, gloves. We usually advise to double up with the gloves. Gown, shoe covers. The patient and all family members that are present during treatment must wear masks. So to prevent them from, if they're coughing or anything like that, from getting that onto us. We also have we have to take vital signs. So instead of taking our equipment in, we actually leave equipment there for the patient. So we leave a thermometer, blood pressure cuff, pulse ox there in the home, and that's for that particular patient to use. So that reduces the risk of us having to take in our bags or equipment in there. If the patient needs assistance with a gait belt, we leave a gait belt for that patient there as well. So we're not taking stuff out of the house to carry to other homes that we have to treat patients who are not positive. And basically wipe everything down. As soon as we leave the house, we have to take everything off, put it in a garbage bag, and get rid of it. I also spray myself down. And I have a plastic lining in the car, on the car seat and on the steering wheel to prevent any transmission of stuff that I get rid of as soon as I'm done for the day. I take my clothes off in the garage and get into the shower right away before I come upstairs. So that's basically what I've been doing. I think she got disconnected.
Did we lose her? Yeah, I've had similar, we haven't been treating as much COVID-19 active cases, but we've had a lot of community transmission in New Haven, Connecticut. We're one of the top 10 counties in new cases and in deaths. And we have very close proximity to New York City. So, we're a high risk community. And even our patients who are non-COVID-19 survivors, we're taking a lot of extra precautions in terms of equipment and cross-contamination risks. And, there's a substantial limitation on the number of visits we're providing to even non-infected patients, the spillover effects, which are disproportionately hurting older adults who are staying inside more, are more likely to be homebound, and for whom inactivity for even short amounts of time is pretty detrimental to health. So it's been a pretty major concern for me in terms of who we're missing and who's not going to the hospital and who's not getting medical attention. The people who are at risk for falls, at risk for deconditioning, just because there's such a shortage of equipment and it's rightfully being, requisitioned and used by people at the highest risk that are treating active cases. But it's really, there's such a spillover effect for people not seeking or receiving necessary care as a result. And that's really the concern that I've been having, that there's just not enough personal protective equipment to protect therapists that are trying to provide care to these vulnerable populations.
Yeah, and I think it speaks to some of the advancements we've seen or leveraging of telehealth. So what we've been doing with our clinic services, we've, the tough thing is that all of this is kind of being done on the fly, right? We didn't have a telehealth system in place really for any of our services, but we've out of kind of the ingenuity of chaos, right? We've developed something that we can deliver to reach those populations. Jason's absolutely right. Like we are hyper focused on taking care of these very critically ill patients with this pandemic, but let's also not forget that we live in a country where 6 in 10 people have a chronic disease, 4 in 10 have 2 or more. So not all of them are getting COVID and in the hospital. They still have ongoing needs, especially geriatric populations. Those are those with pre-existing issues. We still need to find a way to continue to deliver care while protecting ourselves, protecting the patients, because you're right, we can't, we need PPE for those facilities, and it's just, we need to find ways to be creative with how we're delivering care. And I think the telehealth option's been useful. The tough thing is, like, not all of our patients have, the ones I work with we're primarily from the south side and west side of Chicago, like, might not have, a smartphone or tablet. Good number of them do, but that's also an issue. Like, how do we get the infrastructure in place to get, what we need to deliver these services at a high value too, right? Because there's still cost to everything we do. So.